6:09. October is Breast Cancer Awareness Month, and for women facing a breast cancer diagnosis, one of the biggest decisions is often what kind of surgery to have. As part of our Ask the Expert series, 7 News' Kelsey O'Donnell spoke with a doctor from Bon Secours about what patients should know before making that choice.
When it comes to breast cancer surgery, options can feel overwhelming.
Hello.
Dr. Jennifer Beatty, director of Bon Secours' Comprehensive Breast Program, says it starts with understanding what each procedure involves.
A mastectomy means the removal of the entire breast. That can include reconstruction. A lumpectomy is just removing the breast cancer from that breast and then some tissue around it.
Dr. Beatty says both mastectomies and lumpectomies are effective treatments for breast cancer, but the best option often depends on the size of the tumor and the patient's comfort level.
A lot of times it's personal preference for the patient, but education is showing that more people prefer to do lumpectomy. Lumpectomy usually is smaller tumors.
Doctors say survival rates are equal for both procedures, but there are still some misconceptions.
Some people have the idea that if you remove the whole breast, the breast cancer can't come back. That's not true.
Even with a mastectomy, health experts say the risk of recurrence can still range from 10 to 30%, depending on how aggressive the cancer is. Recovery time can also vary per patient depending on which surgery you choose.
It's really important to know that if you decide on the surgery, you shouldn't base the recovery on the decision, because this is a forever thing.
Health experts say some of the most important steps are taking the time to ask questions, understand your options, and decide what's best for you.
Well, patients should ask all these questions like, am I a candidate for lumpectomy? Why am I not a candidate for lumpectomy? What is the survival benefit if I do a lumpectomy versus a mastectomy? Should I remove both breasts? Is there a survival benefit for removing both breasts? And I think asking questions about sexuality. Will I still enjoy sex? What does it feel like not to have any sensation in my breast?
Health experts also stress that regular screenings are critical for early detection and that men can be at risk too. Dr. Beatty says breast cancer can affect anyone at any age, and early detection saves lives. For this week's Ask the Expert, I'm Kelsey O'Donnell.
Remember, you can submit a health topic for our Ask the Expert series. Head to our website, click the News tab, then Ask the Expert.